The field of biomarkers in prostate cancer is exploding exponentially, and it has been for some time now. The challenge is that most of the biomarkers that are commercially available are not reimbursed, and some might argue are truly not yet ready for prime time, meaning they don't have CMS validation for reimbursement, and most of the third-party payers won't back them up. That said, knowledge is power, so the more information you have, potentially the better. Biomarkers first begin by demonstrating that the marker has assay validation. It's repeatable. It has a methodology that has reproducibility. Then it has to show some clinical validity. In other words, what did you set out to do? Did you set out to decide was there cancer, no cancer? Did you set out to decide there was an absence of cancer on a repeat biopsy? Did you set out to decide or discern the aggressiveness of a cancer? And that's called clinical validation. So you go from assay validation to clinically validating it, and then most importantly, you have to do what's called a clinical utility study. For the lay person listening to this, did this new information of this biomarker change what you and your doctor were going to do? And those studies have to be done, and there are certain companies that are out there doing it because CMS, through the Molecular Diagnostics Program, also known as the MOLDX, M-O-L-D-X, is saying they want to see clinical utility studies. And it really is saying, I got this new information, I got this new biomarker, I presented it to the patient, we both discussed it. Did it change what we were going to do if we hadn't had it? And I really like that because as a taxpayer, as well as a clinician, I want to make sure that I'm getting information that's truly actionable and not just for my own academic curiosity, unless it was a free test. But invariably, these tests are not free. So for the patient right now, there are a lot of biomarkers that are out there that will potentially help better inform them, should I have a biopsy or not? If I had a negative biopsy, do I use this assay to help me decide to get a second biopsy because maybe I missed it the first time? And then there are additional assays that are available when I get a diagnosis of cancer. Does it help better inform me more than just what the pathologist read under the microscope, the histopathology report, my PSA, and my prostate exam? So is there a fourth thing, what are known as genomic assays, to help me better stratify? Do I have that aggressive type of cancer that people talk about, or that non-aggressive or indolent type of cancer that may not ever cause me harm? That's where these biomarkers are today.